And listen, thanks for the comment. Public health informatics, I'm greatly understand the impact of AI in health, especially for African healthcare systems. You know, let's just talk about AI and health for a few seconds, because I think there's a lot to be said here, and we maybe need to do like a whole live stream where we just focus on AI entirely. Of course, there's the stuff we've just spoken about, how to use language models to help us with research, et cetera, and I think that's all very exciting. There are lots of other important implications of AI in healthcare. And just to name a few, but just to state the obvious, you know, AI in diagnostics, huge. The
Radiology,
ability
yes.
of these neural networks to look at CT scans and X-rays and retinas and all sorts of clinical diagnostic requirements, and are better than people for the most part. That has massive implications for low-income countries, because where they can't afford to have an army of radiologists, they can get an AI to be looking at these things and have one or two radiologists doing a kind of high-level sanity check on things. So huge implications for human resource deficiencies or deficits in poor countries. Now, AlphaFold will do tens of millions of them in a few seconds, and it gets it almost entirely right. And the implications thereof for research and new drug development are phenomenal. Now, we won't see drugs today or tomorrow. It might take 10 years before we see, you know, the real impact of this, but I think we will see it. And I think it might be the sort of thing that brings down the price of medicines and drugs substantially, which means increased access to medicines, even in low-income countries. I think it'll have huge implications for people living in poor countries in the near future.